Hi, this is Dr. Ibrahim here today from Fairhope, Alabama, where I came for training on PRP injections of the joints. Today, my mentor was the legendary Dr. Jeff Piccirillo. How are you doing today?
I'm doing great.
All right, good. So he was today. We were talking about how giving steroid shots to the joints are very bad for you, and despite it is what everybody does, orthopedics and primary care doctors, they kind of destroy the cartilage, and you end up at some point changing your joint. So how can you elaborate?
Yeah, you're absolutely right, and it's sad. My background's orthopedic surgery. I did conventional orthopedic surgery up until January of 2009, and injected probably 12,000 or more steroid injections into joints. And we knew the data. The first article came out that showed that actually steroids cause disruption of things like tendons in the rotator cuff and in the hand and in the elbow. The first study came out about 1979. So I wasn't even in college yet. I was still in high school, and those articles came out, and we just kind of ignored it as orthopedic surgeons, and we continued to inject steroids, knowing that we were causing we'd relieve pain, but we'd cause increased breakdown of the cartilage in joints. Rotator cuffs would start failing, so we knew there was problems, but we didn't have a solution. I did my first PRP injection in 2002. And as we started doing that, we realized that we did have a solution, that platelet-rich plasma, or PRP, would help rebuild tissue. So now if we injected a rotator cuff, it would build new rotator cuff tissue. If we injected it into a joint, it would actually help save the cartilage. So we did have a solution. The problem is insurance companies do not cover these injections, which is a problem for the doctors, and it's a problem for the patients. But the other problem is that if you use steroids, which is covered by the insurance, you're going to end up needing surgery at some time down the road. Surgery is dangerous. There's risks. There's even risks of death under anesthesia. So PRP is definitely the better way to go if you can find a way to get that into your budget, and then save your joints and not need the surgery. Every time you have surgery, you're going to miss a couple months worth of work. I mean, it's a big deal. So the new technology is definitely the way to go.
So, and you've been doing the PRP injections since 20...
So I did my first injection in 2002 in the operating room, so over 20 years ago.
Wow.
We made it a full-time practice in 2009, so we've been doing it full-time since 2009.
Beautiful. And results, no problems?
No, so almost no complications. There's 15,000 articles on PubMed about PRP, and it really only mentions two complications. One is somebody injected PRP in the eyeball and caused blindness. Probably shouldn't do that. The other was PRP mixed with some type of filler, and it was used in the face, and it caused some necrosis between the eyes, which is an area you're not supposed to inject anyway. But those are really, no infection, no tumor growth, no tissue breakdown. So pretty risk-free.
Excellent. So here we have it with Dr. Jeff Piccirillo here from Fairhope, Alabama. If you have any joint problems, or anybody suffering from any joint problems or any pain anywhere, just give us a call. Thanks. Thank you, sir.
You're very welcome.
All right. Thanks.